Hi, Assalamualaikum dan salam kenal. I'm Dr. Idyani, Consultant Obstetrician and Gynaecologist from Oriental Malacca Streets Medical Center. Today, I'd like to take a moment to highlight something very important for all the women out there, the importance of cervical screening. Did you know that cervical cancer is one of the top cancer among Malaysian women? It ranks third just after breast and colon cancer. The good news is cervical cancer is highly preventable because it develops slowly over years. It takes about 10 to 15 years. Regular screening gives us the chance to detect early changes at your cervix before the cancer develops. Most cervical cancer happen in women who have never been screened or don't screen regularly. So what causes cervical cancer? About 95% of cervical cancer linked to persistent infection with a virus called human papilloma virus, HPV for short, specifically the high-risk types. Most people will have an HPV infection at some point, and usually the body clears it naturally. But in some, especially to those who are immunocompromised, smokes, have multiple sexual partners, or start sexual activity at a very young age, the virus may stay and cause abnormal cells changes that can develop into cancer over time. The cervical screening test helps detect those early changes long before any symptoms appear. You should have your screening even if you've been vaccinated against HPV, you've no longer sexually active, you've had the same partner for many years, even you've gone through menopause. In Malaysia, women who are sexually active are encouraged to start Pap smear test from age 21 till 65. It is repeated every 3 years. For women aged 30 to 65, HPV testing is recommended, and I personally encourage the co-test, which combines both Pap smear and HPV test for better accuracy. So how the test is done? So during your visit, a plastic speculum is gently inserted into your vagina so we can see your cervix. A soft brush is then used to collect the cell samples. It's here. If you opt for the co-test, an additional swab will be taken for the HPV testing. The process may feel slightly uncomfortable, but it shouldn't be painful, and it is very quick. So if your result is normal, your next test will be the next 5 years. If anything unusual appears, your doctor will guide you for a follow-up or for a colposcopy, which is just a closer examination to look at your cervix. Lastly, do not forget the HPV vaccination. HPV vaccine is recommended for age 9 to 45 years, both male and female. It's a powerful way to prevent infection and protect yourself further. So, to all women out there, take charge of your health, get your cervix checked. Visit us at Oriental Malacca Streets Medical Center for your cervical screening today.